Hey YouTube, it's Marita and welcome to another edition of the Nurse Lounge. In this edition, I have been specifically asked to actually discuss the DNP curriculum. So I'm kind of going to do that here in this video today. And you understand when I say kind of when we come back. Something you want to see? Stay tuned. All right, welcome back. My name is Dr. Marita P. I'm a registered nurse, been a nurse for almost 17 years now. OBGYN, well baby nursery is my specialty. I am a nurse educator. I teach at HBCU. We're on break now, but teach at HBCU, and I am doctorally prepared. So let's go ahead and talk about the DNP curriculum. Now, this was a video done, or this is a video done by request, and it's a great topic. However, I want to say the only caveat to this video is that I can only give you a generalization because of the fact that every program really is different and it's based off of what you specialize in. So my degree is in executive leadership, so all my classes are going to be geared towards executive leadership, where somebody else's may be geared towards education or geared towards something else. Same thing with the master's program. So the only thing I can really go over with you in this video is the general core classes, and even that per institution is generally can be different. There should be some similarities, but it can be kind of different. The clinical hours can be different in terms of what's required. So what I decided to do this for this video is to kind of go through my program specifically that I did to give you an idea of what a program is like, but you will need to do the research on your own and look up the program that you're into in terms of your specialty area. Mine was executive leadership. So to see what classes are required. Some of these classes will be familiar or will be the same in those programs. Some of them will not. Some of them are specific to the university that you go to or the school that you go to. So let's go ahead and jump right on into my curriculum for my DNP program. Let me say this again for everybody who wants to make generalizations. This is specific to my program. You will need to do the research to know what program or to know what classes you will need to take. So this is just kind of a general guide about what's out there. You will have to figure out your own program when you look it up. So I do have my notebook because I wrote the classes down that I took. For me, my program I think was 38 credit hours total. And my core classes included, so my core classes were faith and science. Now, just so you know, I went to Union University, which is in Jackson, Tennessee. It was a hybrid program, meaning that it was mostly online. However, every semester we came in for about 3 or 4 days for in-class instruction. What did that mean? It meant that for us, we finished the semester that we were just in for a couple of days, and then the next couple of days we started the intro to the next semester. So we saw each other together like that. I personally like that. Some people just like online classes. I'm not really a fan of all online classes because I feel like you don't really get to know the instructors. You don't get to know your classmates. And I love the fact that I really had a good relationship with my classmates. So when it came time to do group projects, we actually knew each other and we knew each other's strengths and weaknesses, and we kind of played off of that versus just seeing somebody online and seeing somebody's picture in a bubble online versus actually getting to know someone. So for me, the hybrid program worked great. I loved it. So I went to a private school, so that meant tuition cost much more money. They have different requirements. It was a faith-based Christian school, and they had also other provisions in which we could or could not do. I was drug tested randomly several times throughout my program. That's normal, at least for our program. So the first class that I took for the first semester was called Faith and Science. So Faith and Science is basically just a class geared towards the university. And most Christian schools will have a class like this, whether you are undergrad or graduate. A faith and science class or something that is geared towards religion. If you are not going to a faith-based school, then you probably won't have you won't have a class like that. That's just because I went to a faith-based school. So faith and science was my first class that I took. And again, it was basically talking about how we can bring, how do we bring religion into healthcare, vice versa, healthcare into religion. So it was kind of like that. The next class I had was methods of evidence-based practice. That's kind of like your research class that we had to take. So I hate research, but that's one of the classes we had to take. Hate it, hate it, hate it. But we did have that class. So that's a class, more than likely, every program typically has a research class. Whether you're in your master's or doctoral program, you will have research classes. Now, if you're getting a PhD, I got a DNP. If you're getting a PhD, you will have more research than what I had in my DNP program. I took epidemiology. Epidemiology is basically a class where you're talking about statistics and you're talking about, think about COVID. That whole situation right there is epidemiology in terms of the mortality rates, the morbidity rates, the risk factors, the chances of this, that, and the other. That whole situation right there is epidemiology. So people, whoever taking this class right now during COVID, they learning, they really get a bird's eye view about what that's really about in terms of how to do that. Epidemiology was one of my hardest classes. I really had to focus and study in that class. I did get an A, but it's not my strong class. I'm not really that great or well with statistics, but I managed in that class. Technical transformations in healthcare. That was kind of like your informatics class. I don't like informatics either, but I took it. You know, I got an A in it. Informatics is basically dealing with your Medicaid and Medicare. It deals partially. It deals with your what else does it deal with? It deals with your, what is it called? Like your charting system. So those are the people who kind of, you know, do the charting systems and create those systems that we actually chart in. Your Epic, your McKesson, they're the one who changes those. That's what informatics partially does. The rest of it has to do with, again, some Medicare, Medicaid, some other things that they have to do. Again, it's not my strong point. I learned it just enough to get through the class. I don't ever plan on going into informatics. Healthcare policy and economics, same thing. It's not informatics, but it is based off of Medicare and Medicaid and policies regarding that. It is the why we do, what we do, when we do, based off of money, reimbursement, things like that. If you have an understanding for why we do things, you understand or how Medicare, Medicaid works, how the government is impacted or not impacted, how the government impacts those types of things, you have a better understanding as to why doctors do what they do or don't do what they do. You know, one thing I remember from that class that stood out to me was that the doctors don't get paid. They only get paid to do something. So they have to always be able to tie a, they have to always be able to tie an intervention to something to get paid. So they don't get paid to come in there per se and come see you in the hospital for those 15 minutes. You wonder why they're in for 15 minutes? And seeing people in and out, it's because they don't get paid for that. They get paid to go to that clinic and work. They get paid to do those surgeries. They get paid to do things like that. So once you understand why they get paid, a lot of them ain't gonna sit up there and be talking to these patients all day long. Okay, they gonna come in there for 10, 15 minutes or whatever they're gonna do. Say what they need to say, document what they need to document, discharge people, do whatever, and send them out, and they head on back to the office to do what they actually get paid to do. Because keep in mind, when they come to the hospital, to see patients, take me for OB as an example. Once they have that baby, the doctor has did his thing. Postpartum and all that right there, the doctor doesn't get paid for that per se. He got his money under, he or she got their money under the fact that they did the care, they delivered the baby. So I'm not saying that part is free per se, but when they come in the next day, they only get paid to tie it to an intervention or something they've done, a service provided. They don't get paid for anything. So I learned that in that class. I learned in the class too why nurse practitioners want and need full practice authority, FPA. And we learned all that in that class. Now, am I in school to be a nurse practitioner? No, I was not. But we learned all that in that class. It was a great class to learn. Again, not my thing, but it was great to learn. Then after that, that was pretty much the end of my core classes. After that, for me, I went into my actual classes for what I do, my specialty, which is executive leadership. And those classes included my DNP project development. And what that basically is when you actually come up with your title of your project, what your project's going to be about. You kind of run these by your advisor. You kind of start working on initially the IRB proposals, things like that. That's kind of what that class is for. And let's keep in mind that when it comes to the DNP project, that is not the same thing as a dissertation that the PhD students do. The PhD students do dissertations. We do capstones or projects because we're going to take our project and hopefully one day implement that into practice somehow, some way. So when it comes to your DNP project development, you are basically saying, this is what I want to do it on. This is this is the population I want to do this with. This is the outcome that I want to have. And then you go from there. You have your IRB process, and that's a long process in itself. That was treacherous. And that's pretty much what that is, because you're developing your project. You're trying to see if you're going to get approved or not in your what you're planning to do. All that's in your project. Then I had leadership and teaching practice strategies. That's a separate class about being a leader and what that means to be a leader. And then teaching practices, because I am an educator, so they kind of tied that in together. And then strategies to do so. I had to do a presentation for that. I had to actually find out, go to a program or go somewhere and find out problems that they are having and basically come up with a solution for that and go present that to like the director or somebody over that department. For me, it was a director over nursing. Then I took organizational leadership and management, and that's basically what the name says: organizational leadership and management. You're managing, and it's again a class that's talking about how to do so. And then the next thing was DNP project implementation. So now this is a semester, second to your last semester, in which you are now putting your project into practice, or not into practice. You're actually going to implement your project. So you're going to, maybe you are wanting to see what the catheter rates are for nosocomial infections at whatever hospital, and you have a plan to devise and whatever. You will then put that into practice. Or maybe you want to do a survey on nurse burnout. Something simple. Let's just say it was that, okay? A survey on nurse burnout. This is the semester that you would actually go take those surveys and send them to those nurses and basically get your data. You would collect your data. You would get a statistician to analyze your data. That's what project development or implementation means. You're going to actually go through that whole process and implement it. I take that back. You're not going to get a statistician yet. That's in project completion, which is the next class. Implementation is what I said it was, where you actually put everything into work. So you actually do the survey, you actually, implement whatever you're trying to do. You get the nurses to participate on the survey and stuff like that. Project completion, the next course, which is the one you're going to graduate with, is where you actually collect your data, get a statistician, get your analysis of your data, what your findings were, and then you present your presentation to your faculty advisors and and whoever else is on the board, and that determines whether you get your title of doctor or not. Now, in addition to that, we had what's called fellowship hours, which is also known as clinical hours. And for a doctoral program at that school, we had to have 660 hours. So over 3 semesters, I did 660 hours in clinical, in addition to these classes, in addition to working, in addition to kids and things like that, all during COVID, mind you. So 660 hours we have to have just at the DNP level. Now, when you graduate, our program required us to have a total of 1,000 post-baccalaureate hours. So that's including your master's degree, that you have to have that many hours collectively between the master's and the doctoral program was 1,000. Anybody who did not have enough had to complete more hours in the doctoral program. So when I did my master's, I had over 300 and I want to say 60 or 80 something hours that I did in my master's program in nursing education. So they took that number and they added it to the 660. When I finished, I had more than enough hours. There were some people who had programs in which they only had 150 hours. Well, 150 plus 660 does not add up to 1,000. So all those hours that are left over from that, they had to do all those hours in the doctoral level, so it would add up to the 1,000 hours they had to have post-baccalaureate. So hopefully, me kind of going through that with you a little bit helps you in deciding what kind of program you want to go to. Again, that's just my program. I could not do a curriculum for everything, for everybody, because they vary so much. But that's the gist of what a program was going to look like. My program was 38 hours. However, if you want to be if you're a nurse practitioner trying to get your doctorate, it may be other hours. If you're trying to get a BSN to DNP, it's going to be even more hours. It just depends on the program you want to do. Mine was postmaster's program that I did. So because mine is postmaster's, because I already have a master's degree, that's the program that I have or I chose, so I only have to do 38 hours. It's going to vary based on the program. You have to do your research. Hopefully this helps, and definitely comment below what program you plan on going into. Mine was executive leadership, which basically means that I can be in like leadership type positions, like your director of nursing, your dean of nursing. I could be a president of university. I could be a provost. Or let's just say I didn't want to work in academia. I could be a CNO, chief nursing officer at a hospital. I could be in those higher up executive leader positions, not management. I'm not talking about being a nurse manager. I'm not talking about being a director I guess I could be a director of nursing, but I would simply say I could be in the executive level positions with that degree. So that's what I have, my degree in executive leadership, and it's great. It works fine for what I need to do, what I'm doing. I am a full-time educator, as you already know. And, you know, right now I'm just working as a full-time educator, but because I'm working and kind of working my way up, I have no issues or won't have any problems becoming a director of nursing, dean of a health science department, or whatever it happens to be, because I already have the title or the education behind it. I just need the experience to get up there. So comment below those questions that you may have. I would love to do a video for you. That's what you want, to help answer your nursing questions. Also, follow me on IG. I will have that on here. Also, follow me on TikTok. That will be on here as well. And basically, that is it for this video. Thanks so much for watching to the end. And until the next time, you all take care. Bye-bye.